Welcome to the HealthManagement.org podcast series. Today, consultant neuroradiologist Professor Kyriakos Lobotesis explains what the latest economic data shows us about mechanical thrombectomy as a first-line treatment for stroke.
Mechanical thrombectomy is a treatment in acute stroke patients that was introduced in 2015-2016. During that period, there was a plethora of large publications which demonstrated the huge clinical efficiency of the technique in comparison to what we had beforehand, which was the best medical therapy in the form of intravenous thrombolysis. Despite the data having come out nearly 5 years ago, in the United Kingdom, we carried out last year around 1,600 thrombectomies nationally. Now, the prediction with regards to thrombectomy overall per year in the United Kingdom is something in the region of over 10,000 procedures. So we still have some way to go, despite the clinical efficiency and effectiveness of the procedure and service being proven. Now, the major obstacles for the implementation of the service in some cases have been financial. It's a procedure where if it isn't carried out, the patient is left with a huge neurological deficit and disability, which is then a burden not only for the healthcare system, but for society and the taxpayer in general. If the procedure is carried out, in the majority of these patients, what we see is a reversal of their symptoms, and they are more or less able to return to normal life. So the economic benefits are very important to highlight. Now, more recently, what people have been looking into is not just how to open the vessel in thrombectomy cases, but the actual technique and efficiency of the technique. The term in the field that is utilized a lot recently is first pass effect. What first pass effect means and represents is the utilization of the right technique and devices that allow the opening of the vessel up in a time-efficient but safe way, leading to the best clinical results. Now, if you tie the first pass effect concept with a financial parameter, then what you come across is, and this has been demonstrated very recently in a sub-analysis in the Journal of Neurointerventional Surgery, that there are even larger economic benefits when the technique of thrombectomy is carried out with a first pass effect as the optimal target and outcome of the procedure. Now, given that in the UK, we are only carrying out about 10 or 15% of the thrombectomies, and how many more we need to do, but the overall growth that is necessary worldwide with regards to this technique, it's very obvious that when focusing on delivering this service, and especially in a very efficient way, this will lead to significantly better outcomes for the patient, saving millions of lives worldwide, but also with huge cost savings to healthcare systems everywhere.